Hello, my name is Molli Dodaro, and today I'm going to discuss depression in the African American culture. This topic is very important because African American people are continuing to struggle with depressive symptoms without getting any help. To give you a brief overview of what I'll be discussing today, I'm going to start with discussing the problems related to why African American people are more likely suffering from depression. The three problems I'm talking about today are social adversity, negative treatment, and socioeconomic disparities. The next component I'll be talking about is what happens to African Americans who are suffering without help. Depression with no help can result in mistrust in authority figures, incarceration, homelessness, and substance abuse problems. African American people are 20% more likely to report serious psychological distress and are victims of mental health illnesses such as suicide and depression. The last thing I'll be talking about is the solutions to the problem. They can help prevent depression by educating people with depression, preventing discrimination, and helping lower socioeconomical families. Out of all the solutions for depression, African American people first have to trust the people around them. My research question is, how does cultural factors affect depression in African Americans? Depression has caused many problems in African American communities. Looking at this chart, you can see the amount of people who are suffering from depression. 13.2% of the United States identifies as Black. Of those 13.2%, 16% of them have been diagnosed with a mental health illness. This is just the people who have been diagnosed. It does not include the people who are suffering with no help. 6.8 million people is a huge number to suffer from a mental illness. Compare that to all the people in Chicago, Houston, and Philadelphia. When I was researching my question, I used Google Scholar and the UF Resource Library. When I was picking which articles to use, I made sure they were on topic and accurate with my research topic. I also had to make sure the articles were scholarly and appropriate. Social adversities are a reason African Americans have more cases of depression in their culture. African Americans with negative ethnic identity have a higher risk of depression. Ethnic identity is how someone of a particular ethnic group feels about their ethnicity. When the people around you have these negative thoughts about your ethnicity, it affects the way you look at yourself. African Americans specifically have bad ethnic identity, causing depression and anxiety. African Americans were once thought to be immune to depression. This was the persona around African American people, so they were all afraid to be different and get help. They also were in denial about actually having symptoms of depression. In African American adolescents, family and peer support is indirectly related to depression. To prove this, a study was done on 212 African American adolescents about the type of support they get from family and friends and the depressive symptoms they feel. As the support from family and friends increased, their depression and suicidal feelings decreased. Negative treatment of African American people are another cause of depression. One major reason for depression is discrimination. One study that I have researched was a self-reported discrimination in depressive symptoms survey. This was a longitudinal study done on African American women living in Detroit. They found that as depression got better, so did discrimination. Although it took years to figure this out, it has really changed the way people look at depressive symptoms in African American people. Another problem with depression is the misdiagnosis from medical professionals. Medical professionals sometimes do not take African Americans seriously. When they come in and they claim to have depressive symptoms, they believe that it is a side effect of alcohol or drug abuse. Medical professionals are looking at them and assuming this just because they are African American. Medical professionals have also been caught being racist, which prevents African Americans from finding help. When medical professionals can't be trusted, it is hard to get someone to go in for help. This is a picture from a campaign that they started in Australia. They were trying to show people how racism affects the person's health, not just their feelings. This was not just used to campaign against depression, but all health-related problems. Socioeconomic disparities are just another case of depression. Children who felt threatened in their neighborhood had more symptoms of depression and anxiety. The lower socioeconomic neighborhoods were largely responsible for children feeling unsafe in their neighborhood because of violence. They also found out that these lower socioeconomical neighborhoods are mostly African Americans and Latinos. African Americans are inadequately diagnosed and often misdiagnosed because of poor primary care physicians. They often cannot go to the best doctors because of poor health insurance. This goes back to having lower socioeconomic status, which prevents them from having good insurance and a good doctor. This picture shows some statistics on children living in poverty. 1 out of 5 children live in families with incomes below the poverty line. This affects the child's mental health, increases violent behavior, makes them do poorly on tests, and makes them engage in sexual behaviors. As a result of depression, African American people are struggling with their everyday life. This can lead to mistrust in authority figures, incarceration, homelessness, substance abuse problems, and violence. These kind of behaviors can be prevented with the right treatment and care. Trying to prevent depression in African American people is not easy, but it is possible. We need to educate the community on depression and the symptoms. If more people know how common depression is and the symptoms, they may be able to help themselves or even a friend in need. Helping children from low socioeconomical communities get out of the violent neighborhoods and give them more support on their life. This is hard to help because most of the parents are not available to give their children emotional support. Keeping these children busy with activities outside their neighborhoods could be a good solution. Discrimination and racism has been around forever and is a difficult concept to stop. People are constantly trying to help stop racism and discrimination, and it is slowly getting better. Hopefully, in the future, we can stop it and will no longer be the case of depression. Lastly, having access to proper healthcare professionals is extremely important in treating depression and to get better. A healthcare professional can treat you, but without proper treatment, they may never get better. Mental health is an extremely important topic, and in today's society, making sure every race and ethnicity has proper education on the topic can help prevent and treat mental illnesses such as depression. Thank you for watching, and hopefully you know more about depression in the African American culture, and you can help someone in need.